चलो अस्सलाम वालेकुम एवरीवन, वेलकम टू माय न्यू वीडियो। सो गाइस, आज हमारा प्रैक्टिकल क्लास और हम चल रहे हैं अपने कॉलेज में और वहाँ पे हम थोड़ा आज प्रैक्टिकल क्लास है तो हम लोग एग्जामिन करेंगे, फिजिकल एग्जामिनेशन वगैरह और स्कल्टेशन वगैरह सब सीखेंगे। फिर चलिए आपको हम दिखाते हैं कैसे स्कल्टेशन करते हैं, कैसे फिजिकल एग्जामिनेशन लेते हैं, कैसे पल्स प्रेशर ऑफ ऑक्सीजन कैसे चेक करते हैं, पल्स कहाँ कहाँ से मेजर कर सकते हैं, सारी चीज़ आपको दिखाएंगे। बने रहिए हमारे वीडियो में।
Four parameters. How many parameters?
Four parameters.
What are those? First, we see. What do we see in the patient? That is the inspection. What is this? Inspection. After that, we listen. That is the auscultation, right? After that, we try to feel. That is the palpation. After that, we try to produce the vibration. That is what? Percussion. You will see like this. What is here? This is the inguinal region. Eyes should be parallel to the patient abdomen. We don't have the chair, then we can sit like this.
We are going to study about the sinuses. Sinuses is the blue discoloration of the skin. There is two types. One is the central, one is the peripheral. If the central, if central, then it will be problem in the lungs and heart. If peripheral, then there will be problem in the arteries and veins. Type of sinuses is the earlobes on the both sides. This is the earlobes, right? At the nose tip. Another is the inside the lip, like this, okay? And the tongue tip, this, and the finger tip, like here. In between this, inside the limb and the tongue tip comes in the central sinuses, and the other one is the peripheral sinuses. So guys, we are going to check about the icterus or jaundice. First, we are going to check from the eye. Okay. Now come, cameraman, come please here. Now I am using your forefinger beside the cheek. Okay. Now place your thumb here near the eyelid and just look this. If this is not red, it means it is anemia. And when you place your both thumb around the upper eyelid, then you see the sclera. This is the white sclera. But if it becomes yellow, then it will be he will suffering from icterus or jaundice. Okay. Now guys, we are going to check about another side of to see the jaundice. See the palm. If the palm is becomes yellow, then it will be also jaundice. To check about the clubbing. Clubbing means the fibroblast overgrowth near the nail bed. Now I will ask the patient to do like this. Do like this, please. Do, okay. Now you are seeing here near the nail bed there is a hole. If that hole disappears, then it will be the clubbing. Okay. If it become more, there is a more hole, then it's another disorder. Okay. Now guys, we are going to learn about the lymph adenopathy. Lymph adenopathy is the swelling of the lymph node. Okay. Now what is the site of the when we are going to check about the lymph adenopathy is the inguinal lymph node, and then another one is the axillary lymph node, and another is the around the neck. The inguinal lymph node we are going to check here, okay, in the inguinal region. Okay. Now the axillary lymph node we are going to check near the armpit, lower. Okay. There is a foreside. There is a foreside which we will discuss in the later, and the next one is the around the neck. Around the neck we are going to check about the supraclavicular lymph node, and the another is the cervical lymph node, another is the submental, and the other one is the back of the ear and front of the ear. Come, I will show you. So guys, first we are going to see about the supraclavicular lymph node. Where is this? Here, like here. Okay. We'll press. If you feel swollen or swelling, then it will be the lymph adenopathy, swelling of the lymph. And the another one is the cervical lymph node. Where the cervical lymph node? I think here, right? Here is the cervical lymph node. If it is swelling, then it will call that the cervical lymph node. And now we are going to learn about the pre-auricular, right, or the back of the eye. Yep. Now pre is the front and post is the back. We are going to check here. Okay. So now guys, we are going to measure the pulse of the patient, and we will know about this site from where we are going to measure the pulse of the patient. The first one side is the wrist and the radial artery. The second one is the neck, around the neck, that is carotid artery, and third one is the inguinal region, and the fourth one is behind the knee, that is the popliteal, and the last one is the top of the foot, that is dorsalis pedis.
Artery. Inflammation of artery. That is giant cell artery. It's a very wonderful disease. You will learn in the practical. Artery का disease है.